so as to not cut into the time of the speakers and to make sure that we can have enough time to discuss as much as we need to. It's probably best that I introduce our chair of the panel today and our first speaker. Dr. Nicoline Schiess is the technical officer working in the brain health unit in the Department of Mental Health and Substance Use at the World Health Organization. She serves as the point person for various adult neurological disorders, as well as assists in the implementation of the Intersectoral Global Action Plan, or the IGAP, on epilepsy and other neurological disorders. We're incredibly lucky to have you speaking for us today, Nicoline. Please, without further ado, take it away.
Thank you, Viraj, for that kind introduction. If I could just share my slides, maybe you can stop sharing yours and I'll turn on mine. All right. Wonderful. Well, thank you very much for the invitation. I'm delighted today to chair this session of the Clinical Exchange Platform, particularly because it is a sort of a follow-up session to last month that was started on the WHO Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. So I'm sure that many participants who are here today might have been present for that discussion last month and heard the excellent overview of the action plan by Dr. Irina Tamborska. If not, I've put a post on the chat and you can access the recording there. She talks in great detail about IGAP and really it's a wonderful summary of the work that we are doing. So you can access that recording online. So today we are following up on a parallel WHO initiative that is closely intertwined with the Neurology Action Plan, and that is the Defeating Meningitis by 2030 roadmap. Before we get to that, though, I would like to give you a brief summary of the work that we're doing or continuing to do to implement the IGAP, or otherwise known as the Neurology Action Plan. So as many of you know, the action plan was adopted by the World Health Assembly in May of 2022. It has 5 strategic objectives: prioritization and governance, diagnosis, treatment and care, promotion and prevention, research, innovation and information systems, and a public health approach to epilepsy. So each of these strategic objectives has proposed actions for member states or countries, the WHO Secretariat, and international and national partners. And for each of the strategic objectives, we came up with 2 global targets that we hope that people will reach over the 10-year lifespan of this action plan. Each of the countries are able to set their own national targets, taking into account national circumstances and challenges. And so what have we been doing in the process of implementation? So at headquarters in Geneva, we have had many regional advisor meetings on implementation. We had a special breakout session at the Mental Health Forum in October 2022. And we convened a neurology and NGO meeting in Geneva in August of 2022. So you'll see the pictures here of the people who attended that NGO meeting in August. And we had robust discussion on implementation by NGOs. How can NGOs help further the goals of the action plan? We had discussion around challenges and what needs to be done. And we defined what actions WHO can do, what NGOs can do, and what we can do by working together. Equally, if not more importantly, is the work that we are trying to do directly in countries. An example of this is the latest meeting that we had in Ghana in September. We went to Ghana and we met with their ministries of health, the Ghana Health Service, the Mental Health Authority, different NGOs and societies. And we had wonderful discussions on opportunities for improving the lives of people with epilepsy in Ghana. We talked about how to further implement the IGAP. And we talked about the challenges of integrating epilepsy services and other neurological services as well into primary care, particularly in rural areas. We tried to chart solutions for challenges in the healthcare workforce, engagement of community and other stakeholders, and care pathways. Right after this meeting, we had a separate, more focused meeting on access to medicines for neurological disorders. So we talked about availability, prescription and insurance coverage, workforce training, and affordability of medicines for neurological disorders in Ghana. We had a lovely diverse group of stakeholders from the government, from pharmaceutical manufacturers, specialist and non-specialist prescribers, and pharmacists. And we had thorough discussions on timelines and actions to address the pressing challenges around the supply of medication. In particular, we discussed the essential medicines list. So the WHO has their own essential medicines list, and this list lists the medications that the WHO feels are essential medications for treating different diseases. Each national or each country has their own national EML list as well. But many of the medications that are on the WHO EML list are not on the medications for different countries' EML lists. And so this is an important gap that we are trying to fill. In particular, medications for neurological disorders are not found in many national EML lists. So this is a big area of work for us at headquarters. This is going to be followed by a 2-day meeting on the same topic in Tanzania this upcoming May. And so simultaneously, we are also trying to produce technical support and technical advice in different areas of neurology. So for the IGAP, we are currently working on an implementation toolkit, but we are also releasing information and technical support for different neurological diseases. And you'll see here the middle two are technical briefs on epilepsy and Parkinson's disease that we have produced in the last year. Upcoming this year, we will also be doing one on encephalitis. And then you'll see here on the far left side of the screen, you'll see the Defeating Meningitis by 2030 Global Roadmap. So we work very closely with our colleagues in other departments to try and defeat meningitis, and we will hear about this shortly from my colleague. So Marie-Pierre Preziosi is a very close colleague from the WHO. She is, it's my pleasure to introduce her, and she is a medical officer in the Department of Immunization, Vaccines, and Biologicals. It's a delight. I learn from her every day on how to get implementation forward and active. And she's going to tell us today a little bit more about the Defeating Meningitis roadmap, which I will put the link to that roadmap in the chat as she is talking. So over to you, Marie-Pierre.
Thank you so much, Nicoline. And it's a real pleasure to be here with you today and to meet all the members of the network. I hope you're seeing the presentation well.
Yes, we can see it.
Thank you so much. So I will introduce you to a very new and large initiative in the WHO called the Global Roadmap on Defeating Meningitis by 2030. This was adopted by the 73rd World Health Assembly in November 2020. So quite a challenge because it was the year of COVID. Therefore, it was in the second part of the assembly in November, but it was endorsed. And in that resolution, the member states unanimously approved the global roadmap on defeating meningitis by 2030. The first ever resolution on meningitis prevention and control since the organization was created. And a year later, our Director General launched officially this global roadmap. And here we have put the links to all these events, as well as to the roadmap, which is available in the 6 UN languages. So this global roadmap is fully embedded in WHO 13 global program of work, which has 3 components keep the world safe, promote health, and serve the vulnerable, and is fully embedded within the goals, the sustainable UN Sustainable Development Goals. And we work in a matrix in WHO in close coordination and collaboration. This is at global, regional, and country level, with three main entities: the immunization and vaccines departments, the brain health departments, as well as the health emergencies department, so that we touch upon all the aspects of meningitis. And of course, we cross-link with all major global initiatives on immunization agenda 2030, sepsis, antimicrobial resistance, neurological disorder, disabilities, all these major initiatives. And this is fully grounded in universal health coverage. And because meningitis touches upon so many aspects of health, it's a powerful lever to drive progress to primary health care and universal coverage, improving the control of infectious diseases, the global health security, because it can create epidemics, and the access to care and rehabilitation. So now I will ask you to work for 20 seconds with our first question. How many people do you think suffer from meningitis globally each year? So you have four categories: less than 500,000, more than 10 million, 1 to 5 million, 5 to 10 million. Yes, I think we have some very knowledgeable colleagues here, because in reality, the latest estimates is 2.5 million. So I think we have a very good understanding of the disease. So the next, another question for you would be, how many people who suffer from bacterial meningitis, acute bacterial meningitis, you would think are left with sequelae? This is hearing impairment or sight impairment, seizures, cognitive impairment, limb loss. 1 in 2 persons affected, 1 in 4, 1 in 5, or 1 in 8. Over to you. I think you have a few more minutes and we'll see the answers. So we have quite a division of opinions, but in reality, it's about 1 in 5. So quite a large number of people who suffer from meningitis will have long-lasting disabilities. Thank you so much for taking the time to answer us here. We'll go to our last question for this first poll. What are the top 4 pathogens causing acute bacterial meningitis? Meningococcus, pneumococcus, group D strep, and Haemophilus, or Meningococcus, pneumococcus, listeria, or Haemophilus. Third option, Meningococcus, pneumococcus, listeria, and Mycobacterium tuberculosis. And last option, Meningococcus, Mycobacterium tuberculosis, group B strep, and Salmonella. Yes, I think here clearly we can see that you're quite familiar with acute bacterial meningitis. Thank you so much for these answers. And now we'll move on to why and how did this global roadmap happen? Why did WHO got to develop this global roadmap? It's sort of because the burden is so high in every country in the world, meningitis is a threat. As we said earlier, there is about 2.5 million new cases with 250,000 deaths every year. 2019, the estimates vary quite a lot, but it's in this range of figures. And the highest burden is in the youngest, while the mortality varies by region and by organisms, of course, with a high degree of disabling sequelae among affected people, and the highest is with group B streptococcus, which affects the youngest, and with pneumococcal meningitis. The low-income countries are worst affected, and this is a disease which has a huge, enormous impact on families and communities, emotionally, but also financially. It can really drive a family into poverty. Just noting that these numbers do not include tuberculosis and cryptococcal meningitis, which are counted elsewhere. So it started with a big call to the WHO to work on a global vision for meningitis so that it would be aligned with the UN Sustainable Development Goals. And we were really pulled into leading on this in 2017 when we had this global meeting at the Wilton Park in the UK. Thereafter, we had regular meetings with our member states, notably in the African region, because there is an area called the African Meningitis Belt. And there was really a call from countries so that countries and WHO should take this as a priority and bring it to the fore in terms of a public health priority. And this was reiterated over the next years. So we worked through a very organized process with 3 components. We set up a technical task force of experts who had a long-term commitment to defeat meningitis in the previous decades, working with us and other partners. We sort of did a gap analysis, which is baseline situation analysis, mapping where we are, what are the gaps, what are the needs in terms of research, in terms of implementation. And then we went through an iterative consultation globally with a lot of representatives from different multidisciplinary origin and multi-regional origin. And thereafter, we came up with this vision that we are working towards a world free of meningitis. We cannot fully talk about eradicating or eliminating meningitis because meningitis, as you know, has multiple causes. So therefore, it cannot be fully eliminated, but we can work as close as possible to this. And this vision has 3 visionary goals: eliminate epidemics of bacterial meningitis, reduce cases by 50% and death, and then reduce disability, improve quality of life after meningitis due to any cause. And we organize the work into 5 interconnected pillars, which are prevention and control, diagnosis and treatment, disease surveillance, support and care for those affected by meningitis, and advocacy and engagement. Of course, these pillars have of interconnection, but it sort of organizes the work in different categories and expertise areas. And the scope is really on these 4 pathogens: Neisseria meningitidis, Streptococcus pneumoniae, Haemophilus influenzae, and group B streptococcus. They are all preventable by vaccination, or soon to be for the last, because there is a group B strep vaccine which is in phase 3 development, so hopefully will be available before 2023. And of course, meningitis caused by other organisms, in particular other bacteria, are including in strategic goals, so that this brings the benefit for all meningitis, but also other diseases that are caused by the same organisms, such as pneumonia, for example. And this is an example of the roadmap structure for Pillar 4, which is support and care for people affected by meningitis. And as you can see, we have these strategic goals, giving the direction where we need to go for this area of work. And then we have what we call the landmark goals, SMART goals, with a date by which we need to have reached a certain impact. And to get to that goal, that milestone, we have a list of activities which really detail what needs to be done to reach the milestone. And all in all, it's a very multidisciplinary integrated work. And you can see here that the activities can be organized around research, policy and strategy, and implementation. And for example, I've listed here areas where we have made already great progress in terms of the first year of the roadmap. In terms of developing policies, guidelines, and strategies to prevent the disease, that is vaccine policy, but also to diagnose and treat. And we are in the process of updating the guideline for diagnostic treatment and care of meningitis. We also are conducting specific research to inform this policy together with partners and country experts. And then we are also looking for rapid diagnostic tests, so developing product profiles to guide the development of these diagnostic tools that are highly needed. We are improving also the functioning of the vaccine response with improving the way the vaccine stockpiles are working. Finally, we are increasing the awareness about meningitis, and we are closely working with our regional colleagues to help each country to develop their national plan fully integrated. And these are all activities that had taken place in the last couple of years. Finally, as I explained, we had a very strong call from member states that this needs to really strengthen the integration of primary healthcare. And therefore, we have built upon the operational framework for this, and we have tried to put all the directions, all the levers, adapt them all for the meningitis situation. We have received further guidance and support at our last executive board, and we will now move into developing concrete plan with essential packages to be integrated in primary healthcare packages. Finally, I would like to give you a little bit of an overview of what this year is looking like for us. It's quite a pivotal year because we both need to make regional implementation framework and national plans fully active over the course of this year. And we also need to have the ROSUS mobilization concretized. So as you see, we have a pledging event planned for late summer, early fall, so that the global roadmap will be fully funded. And our governance framework includes a technical task force to lead and coordinate in the implementation, and a strategy support group to speed the implementation. So before we close, we would like to ask two final questions. So first, we are curious about your practice and what is the #1 reason for low lumbar puncture rate in your practice? And you have a choice of lack of equipment, fears, insufficient training, lack of laboratory reagent, the fact that this would not change the clinical management, it doesn't impact the clinical management, or you think you don't have a problem because you actually have a high number of lumbar puncture in your practice. Okay, so it seems that we have almost half of colleagues who have a high lumbar puncture rate in their practice, so that is quite good news. And insufficient training comes second. Okay, thank you so much. And so I think the last question is whether you were aware of this global roadmap on defeating meningitis prior to this session today. Yes or no? Thank you. Okay, so it's good that we had this discussion today, so that maybe of you will be towards the yes now, I hope. Thank you for your attention. So here on the last slide, I have put some links of interest to you probably. to the Immunization Agenda 2030, to the Global Action Plan that Nicoline explained at the beginning, and also to the higher standards for persons living with disabilities. Thank you.
Thank you, Marie-Pierre. That was an excellent summary and an excellent talk. The chat has been quite active, so I'm going to start with the first question for you. A frightening problem is the occurrence of serogroups B and X in the African meningitis belt. Even with the tetravalent meningococcal vaccine, these are not preventable so far. And then a follow-up comment on that is, does this mean that the tetravalent vaccines are not effective, or is it due to individual susceptibility?
Oh, so I should reply immediately?
Sure.
Yeah, okay. Thank you, Nicoline. So, so in the African meningitis belt, just to clarify, the multivalent vaccines have not been introduced. What has been introduced is the monovalent A meningococcal vaccine, which is A was the prominent serogroups for a century in the belt, was causing about 80 to 90% of the epidemics. And that has worked really well because the disease has been completely eliminated within less than 10 years. So this vaccine has a dramatic impact. Basically, it eliminated the disease. Nonetheless, we still have epidemics with other serogroups. You mentioned X. We have C, W, and X, but are still causing epidemics in the belt. And for that, WHO and partners have been working to have an affordable multivalent conjugate vaccine, a pentavalent one, ACWYX. So these five valent. And this vaccine is about to be WHO pre-qualified, and we are working towards introducing it as early as 2024 in the first countries of the belt. So switching from the A, monovalent A, to the multivalent, and that will solve that. The B is not yet a problem in the belt. It could become maybe in future years, but there has been no B cases or very little cases in countries of the belt. It's more of a problem in Northern Africa. So B vaccines are still very expensive, but through this global roadmap, we hope to have a diversification of procurement of such vaccines so that price would go down. And the other good news is that several manufacturers are going into merging their quadrivalent meningococcal vaccines conjugates with the B components. So hopefully there will be soon some combination vaccines. Thank you.
Thank you, Marie-Pierre. Thank you very much. At this point, I would like to bring in our other panelists and introduce them to the discussion. Our first panelist is Dr. Abraham Chalanchali. He's Acting National Director for Africa Advocacy Project Liaison on Epilepsy. The organization's focus is to build capacity, create strategic partnerships, and advocate for better policies for people with epilepsy in Eswatini. So welcome, Abraham. And our other panelist is Dr. Viraj Barambi. So welcome, Viraj. Thank you for joining. I have a question to put to Abraham. Given that your organization works with people who are affected by epilepsy, which is often a sequelae of meningitis, can you describe the stigma and the discrimination that you have encountered in people with epilepsy in your country? And how is your organization helping to fight that?
Well, thank you. Thank you so much for that question. When it comes to epilepsy, not only epilepsy, but all neurological disorders in the country, stigma is rampant. And it is in such a way that many persons with neurological disorders, they are placed at a position where they cannot even, mainly they are hidden. It's like it's a taboo to have that child or to have that person, so they are hidden. And once they are hidden, then they cannot, some of them cannot even have national IDs, which is a gateway for education, which is a gateway for even getting a job, so to say, such that they are then driven to poverty in a way that like their lives somehow comes to a standstill. I think that is what basically is about when it comes to stigma in the country. Maybe just to take it a little bit further, our organization has been working on this, advocating for policy change, raising awareness across the country, to a point that when this organization was started in 2003, there were no persons on record of anti-epilepsy drugs. But by 2005, we had over 4,000. And by 2016, we had over 21,000 on anti-epilepsy drugs. So we keep on seeing the numbers growing because people are starting to come out of the closet. They're coming out of the shadows. Thank you.
Thank you very much. Thank you very much. That is incredibly important, coming out of the shadows, so that people can get the treatment that they need. Dr. Viraj, if I could address a question to you that was in the chat, or a comment rather. I believe that rapid and non-invasive lab tests will help a lot while fighting meningitis in some rural parts and undeveloped and developing countries. Could you comment on that?
Yeah, I'm absolutely sure they would. I think that kind of links in with one of the last slides on Marie-Pierre's presentation, which was that you know, a lumbar puncture is not done because it wouldn't inform the clinical management at all. And I think, again, that ties into the availability of medicines, and specifically the antibiotics to combat bacterial meningitis. So it's a knock-on effect, isn't it? Do you do the LP to find out an organism if you don't have the medications to make your treatment more narrow? If you only have a couple of antibiotics available to you that penetrate the CNS and can treat it appropriately, then, you know, why do the LP? So it's something that needs to be sort of built up in concert across the board. So yes, we need to increase the training for healthcare professionals so they can confidently do an LP and do it safely. Yes, absolutely, we need to build up the capability to test appropriately for all of the organisms that could possibly affect a person in any given area, and make those panels specific and area specific. And then, yes, thirdly, and almost most importantly, we need to make sure that the right medications are available, so that when we find out, oh, it's this strain or it's this specific bacteria affecting this person, then we can actually narrow down from, you know, in the UK, for example, we have ceftriaxone that we use as our broad range antibiotic when we think someone has bacterial meningitis, but then hopefully we'll be able to make that a bit more specific when we find out what the organism is. So I agree, yes, rapid non-invasive lab tests would be great, but we need to build up the other pillars, as Marie-Pierre very perfectly sort of alluded to. We need to build up the other pillars around it so that it all grows together, I think. But other comments, obviously, very welcome.
Absolutely, Viraj. I agree with you completely on that. So going into more diagnostics, I'm going to address this question to Marie-Pierre, and it is in the chat from Victoria. Do you think campaigns for the awareness, diagnosis, treatment of meningitis should include other neurological infections such as encephalitis? It may be an opportunity to target more conditions with similar means, but may also make meningitis campaign less tailored. Marie-Pierre, do you want to have a go at that?
Yes.
I can also answer from our perspective as well, if you're when you're done.
Yes, absolutely. I can just say a few words then. Yes, absolutely. You're totally right. And this is exactly what we are trying to do in WHO, is to integrate as much as possible. And you're right. These awareness campaigns have to be tailored to each region, each regional context, and also each national context. in some areas of the world, it would be Japanese encephalitis, which is prominent. So this can go together. In other areas, this will be something else, maybe anything that is of concern in the region or country. And we are trying to do this. Over to you, Nicoline.
Yeah, so exactly the case. And to follow up on that, the sequelae of encephalitis and meningitis or many other neurological infections such as TB or brain abscesses is often the same, so the sequelae is often the same. The access or lack of access to services is often identical. The awareness of these types of conditions is identical for many brain infections. And there is a pillar, as Marie-Pierre mentioned, within the roadmap that addresses the sequelae, and that is almost directly applicable to other brain infections as well. We're also working on guidelines for meningitis diagnosis, treatment, and care. And these guidelines have a section, or we're hoping that they will have a section on access to care for people with sequelae. And that again is, there's a lot of crossover to other brain infections for that. Do we have any other questions or comments?
I think there's one from Greta. Just says, so if someone wants to support these activities in their region, how can they get involved, for example, in a consultancy role? I guess that's probably best for you, Nicoline, first off, and Abraham, if you have any input from your region, that'd be great afterwards.
So absolutely, there are many ways to get involved. And I think that's why, as part of both the Neurology Action Plan and the Meningitis Roadmap, we are we are continuing to reach out to stakeholders. So if you are a patient support group member, if you are a patient yourself, if you work for an NGO that advocates for neurological disorders or for meningitis, all of these voices are heard and everyone contributes in a meaningful way. Even trying to get medication on their national EML lists, even advocating for that. There are so many ways to get involved. And in addition, at the end of the session, we have a few words to say on consultancies that WHO is focusing on. And Abraham, you've raised your hand. By all means, please.
Yes, please. I just want to say something on the point on having some combined kind of advocacy efforts in the neurological space. I think it's one of the most important things we can do, especially in the underdeveloped countries like ours, in terms of combining resources, because resources are one of the most scarce things in our countries, and also raising the voices together and increasing our voices in the neurology space. It makes a huge impact. It makes a huge impact. One of the things that we did when we started transetting in the ICAP in the country, we created strategic collaborations with other neurological focus organizations, such as autism. We had to have some MOUs so that we can start to speak together. And we are starting to see results, good results, because these conditions sometimes in our countries, they are considered like, they think you have a mental case, you are mad. But through coming together and speaking in one voice, we are starting to dispel that thing, and people are starting to understand that these are just neurological disorders that can be managed, and to some extent, some can even be healed. Thank you.
That's highly relevant, Abraham, and thank you for mentioning that about other neurological disorders as well. So we have a question here from Arena. Does WHO have funding streams for stakeholders to action meningitis campaign on the ground to create local guidelines? So we are actually, on the topic of guidelines, we are, as part of the meningitis roadmap, putting together right now a guideline development group to put together meningitis guidelines on diagnosis, treatment, and care. and I'm going to put this out to the audience, particularly the clinicians in the audience who treat patients, as well as to ask one of our panelists, is what are the gaps that you feel exist within the meningitis guidelines? Are there gaps on how long to treat people, what to treat people with, when to treat people, whether it's pre-hospital or whether it's within the hospital? Are there gaps on follow-up of these patients after they leave the hospital? What would be your recommendations to us who are putting together the guidelines on gaps that exist? So open to the floor, and Viraj, if you can take a first stab at that.
Sure, yeah. So I guess I can speak about two kind of environments in which I've practiced neurology and where I think the gaps are. So I'll start with when I worked in India for a while. I think the gaps from my perspective were very much in what to do for the patient afterwards. So I think with in certain circumstances where there aren't many neurologists necessarily to refer to afterwards, or the patient can't necessarily afford to go to the city nearby to see the neurologist thereafter, the sequelae of seizures, disability, spasticity that may develop, it's kind of okay if you happen to be treated by a very knowledgeable physician who knows how to manage all of these sequelae. But I think we all understand that actually that's quite specialist knowledge. It's not very easy to manage things like epilepsy if you don't do it frequently. It's not very easy at all to manage spasticity without access to specific medications and more importantly, specific physiotherapy. So I think guidelines or simple, accessible guidelines in resource limited settings for the complications we can expect from meningitis and things you can do to prevent those complications. And in many cases you can't necessarily prevent them once meningitis has gotten to a specific stage, but things like spasticity, eminently preventable if the appropriate things are done. Things like assistance with looking for mood disorders that can develop thereafter, and I think follow-up is certainly an area where I think everyone has access to acute guidelines, or at least access to a nearby country that has acute guidelines, what kind of antibiotics to give, how quickly to give them, how long to give them for. And then afterwards you kind of go, okay, fingers crossed, hope things go well, but actually a bit more guidance on how often to see the patient, a bit more guidance on how to prevent complications would be really beneficial.
I think, yeah, absolutely. And I think that your point on, on behavioral difficulties or cognitive difficulties is very important, because I think that there's a lot of unawareness within the general public that oftentimes children's behavioral or learning disabilities are not necessarily related to the meningitis. And I think educating people within the community to be aware and on the lookout that that children who have learning disabilities or cognitive problems, it could very well be a sequelae of meningitis. And I think that is one area that there's absolutely a dearth of data on that. So we have, let's see, what are some of the practical tools or ways that could be used to reduce stigma around neurological disorders in rural areas in LMICs? Abraham, may I give that question to you? What are some tools that you have used within your organization or other organizations like yours to reduce the stigma around neurological disorders?
Thank you. In dealing with neurological disorders, when you are fighting stigma, we have learned that you need to use multiple approaches, because it affects different people at different parts of the country, rural, urban, and it also affects people in terms of, like women, they're mainly the most affected. So sometimes you need to have some tailor-made material that will speak to a mother with a child with epilepsy. Something that can appeal to them, but then zeroing it down IEC material, it works a lot. But also campaigns.
Yeah.
Campaigns are powerful because in like we know that the media, the public media will normally follow up any campaign, and the message, runs fast. And also when you carry out campaigns, it becomes more often advocacy approach to it, because you are raising your voices to policymakers, even if they don't want to listen to you when you speak to them on a round table. But once you have a campaign, people will start to question them. What are you saying about this condition that people are speaking about, during the campaigns? So I think those are the main ones I can single out that have worked for us.
Fantastic. Thank you. One last question before I'm going to hand this over to Greta is, how can we improve the pre-hospital emergency care of patients with suspected meningitis? When are antibiotics before lumbar puncture appropriate, particularly in remote area situations? Marie-Pierre, would you like to answer that? How to improve the pre-hospital emergency care of patients? So before I hand it over to you, I'm just going to say that these are some of the questions that we are looking at within our guidelines, and we hope to answer that question 18 months from now when we publish our guidelines. But in the meantime, Marie-Pierre, would you like to answer part of that?
Yes, sure. So the question is about how to take care of outpatients before they go to the hospital, how to accelerate. So yes, this is a very difficult task, actually, in many countries because of the lack of awareness. So we are really, on the one hand, trying to have activities that will raise awareness so that people will know the signs and symptoms of meningitis quite well, and also spreading the message that it is a total emergency. Whenever these signs appear, this is an emergency, and they need to reach out to the closest health center or hospital. And then I think in some settings, it's also, if there are cases already starting to grow, to accumulate, it's very important to do more awareness around these cases so that other cases can be prevented. And I wanted also to complement something regarding, it's related to this question, but also to somehow to what Abraham was saying. When we were developing this global roadmap, it became very clear that assessment of impairment and provision of rehabilitation services around those affected with long-lasting disabilities and meningitis were totally absent, or at least insufficient and inequitable in many places, and that this should be addressed in alignment with existing commitments to disability rights and disability inclusion. And there is this UN Convention about disabilities, and adopting this framework and this aspiration of this right-based agenda was really called for when we developed the roadmap. And in terms of advocacy, it seems that it's very potent in that, for example, there was this idea that disability surveys in India a long time ago really convinced the government to go into polio vaccination. And that also this can really help drive the meningitis agenda forward. So I think it's quite important that we work together, because raising awareness is at the basis of all these activities. And then, as Nicoline stated, we are developing these guidelines for treatment and care, but also we are fostering the development of rapid diagnostic tests at the peripheral level. Thank you.
Thank you, Marie-Pierre. So we have some wonderful questions in the chat, but Greta will not forgive me if I don't speed things up a little bit and get to her opportunities. So I just want to say thank you so much to everyone who attended today, and to the panelists, and for the fantastic discussion that has gone on. So over to you, Greta.
No, thank you. That's been brilliant. And please feel free to respond to things in the chat while I'm nattering away about potential opportunities. So lots of you may have been joining for a long time the Global Brain Health Clinical Exchange. We're going to be trying over the next few months to be moving from chatting to chatting and working together, trying to create groups, getting funding, doing research and so on. And this is kind of the idea that we talk here, but then we can have spin-off projects if there are things that people are interested in. The first, and we're going to advertise opportunities every week. So the first one, last time we had a sort of very high level research opportunity. This time is more for PhD level. Some people here might have them, some people might not. But there are websites where you can filter for fully funded PhDs, including in the UK, where they'll pay a stipend and pay for the fees. When you go on the kind of Find a PhD website, you can filter for neuroscience, and there are sort of 40 that are sat there already at the moment. And so you can look, and often these are eligible for people all over the world. And as I said, with full funding. The second thing is with the Encephalitis Society, we touched on it today. They're very kind of outward, global looking charity. And they've got a session next month called My Brain and Medicine on the 24th of April. It's free to join. It's just for an afternoon. They're going to have an event in London, but it's also hybrid online. They do offer free professional membership, which gives access to some training and some grants. And they typically do an annual seed funding that's for about £10,000 and is primarily aimed at people in low and middle income countries. So it's worth keeping an eye out or having a think about what you could do with £10,000 in ready for that call this year. The next thing is a learning opportunity. So Harvard is a fantastic university and helpfully offers a number of free courses. And some of these are about health and medicine. A lot of the health ones are quite global health orientated, but also courses in data science, education and teaching, social science. And these can be used for continuing development really at any career stage. I think particularly the data science modules, there's a lot about statistics, machine learning, AI, how you might use those for models in health. And I think anyone really with an interest in neurological disease could find a way of applying that in their setting. The first funding opportunity is with the NIH. So they have a global brain and nervous system disorders research across the lifespan call. It's aimed at researchers working in low and middle income institutions, with the kind of encouraging to partner with either scientists in the US or in other low and middle income settings. I should say the links for these should be going in the chat. So if there's one that's of particular interest, you can kind of get more information there. The deadline for that is November, so there's plenty of time to kind of link in with other people, and that could be through our network here or your own networks. And then the final thing to say is that where there will be consultancy opportunities within the WHO, potentially linked to the Intersectoral Global Action Plan. I put a link to a SharePoint here. You will need to request access if you click the link. But we're also anticipating that the WHO will be creating a roster of local consultants who can be called upon. And we're going to be advertising that hopefully at one of the future sessions. So kind of keep an eye out and keep linked in. And I think finally, if you have opportunities in your setting that you think this network could get involved in, or you think we could advertise through this network, then do let me know. I'll put my email in the chat and we can go to that in the future. So thank you very much to the WHO Brain Health Unit and the University of Liverpool for the funding we've had to support this. And finally, the next session is on the 5th of May. That's from 2 to 3 p.m. UK. It's going to be about promoting intersectoral action for brain health. So a lot of us here will be from the sort of health or medical world, but this is about linking with people in other sectors. And it's going to be hosted really by the Global Brain Health Institute, who are brilliantly intersectoral and have musicians and drummers and psychiatrists and the whole spectrum of what you could do with brain health they have within their fellows. And so that will be the focus next month. Thank you very much. So I think that's everything from me, and I'll just hand over to Nicoline to close the session. Thank you very much.
Wonderful. Just thank you very much, Greta. So thank you to everyone, and we hope to see you again next month with your enthusiastic and interesting questions, and we look forward to continuing the platform. Thank you.
Thank you so much.
Have a nice weekend, everyone.
Thank you. Goodbye.
Bye.
Bye-bye.